I've been listening to everybody talk, and it's amazing. I just started to learn about MPN, through Ann, and she asked me to do this, and it's a pleasure. Hopefully I can give some great insight, on exercise. I'm by no means an MPN expert, but it's been wonderful hearing everybody and the depth and breadth of knowledge you all have for this. And what I'm here to talk about, is the exercise part. So let me get here and play this slide for you guys here and get to the screen share here. And I think everybody knows that it's going to be important to exercise. But let's see if we can get this up here. But what should we be doing, and why should we be doing it? And that's a big thing we need to ask ourselves. Are we doing the right things? What should we be doing? And how should we be doing it? So that's what I'm going to be going for. And also, things of, what is it going to do for MPN patients? How is it going to help? What's better for MPN patients? Maybe what isn't so good?
Justin, excuse me. Are you in presentation mode?
I am.
Okay, and share screen.
I am.
On the bottom, green. Yeah. The green.
Oh yeah, I am in it, and I'm not sure why it's not doing it.
It's not showing.
Okay, well, let me see what I can do here. At any rate, because I could even talk to you guys, because it's really just pictures, quite honestly. So I'm going to talk about a few things, so we can't get this going, Ann, because I just did a Zoom about at 10 a.m. and everything was good to go. So I'm not sure what's going on here. So we're in that mode. Let me try one more time, okay? Thank you for your patience, everybody. There we go. Yeah, so Ann, I'm not sure what's going on. How about I just go ahead and continue on and go ahead and keep going. How about that?
You go right ahead.
All right, awesome. So you guys just get to see me. How about that? Instead of my presentation here. And really it's just going to be, pictures. As Ann said, I'm Justin Grinnell. I am the owner of a place called State of Fitness in East Lansing. And I've been a trainer for over 20 years now, over half my life. And I've had the pleasure to work with, everybody from every walk of life. And so through that course of time, it's really given me an understanding on, not just thinking about what exercises we should be doing, but why are we doing exercise? And unfortunately, a lot of people, and maybe it might not pertain to the MPN folks, but weight loss, that's the first thing we think of is going to be weight loss. And unfortunately, if you get into exercise, statistics show that you only have about a 6% success rate if you start an exercise program purely on weight loss. And so what I do with my clients and our members, and of course all the trainers that come through our school for personal training, is we need to find a better why. And whether it's you or for your family, your friends, to be better at work, to have fun, improve your health. There's many reasons why you can do it. For you guys, it's like, how can I get my body maybe to work more efficiently from maybe a blood flow standpoint? Efficiency, the state or quality of being efficient or able to accomplish something with less effort, and accomplishment or the ability to accomplish a job with minimal expenditure, time or effort. And that's what exercise allows you to do in your life, is it gives you a little bit more efficiency. You're able to, your systems in your body work much more synergistically together. It's going to improve blood flow. It's going to improve how your muscles operate. And then two things we have to think about, both as females and also with MPN, is as we age, our bone and our muscle tissue statistically go down. This happens to all of us. It's just one of those things with aging. And really the only way we can combat that is going to be exercise, in part strength training. And so think about how you're going to keep longevity and sustainability, as you move on through your life. And also building the capacity to take on some of these challenges that you're having through MPN. The ability to, or power to do or experience or understand something a little bit better. And exercise can help, improve that capacity so that, you can do other things you want to do in life and try to reduce as best you can some of those things that happen when you have, MPN. And another thing that I try to express to all clients of all levels is your biggest asset in your life isn't necessarily your 401k. It's not your home. It's yourself. It's your body. That is the biggest asset you will ever have in your entire life. And it's also the only thing that you're going to call only yours. That is yours. It's nobody else's. And so and it's tough because trying to find the time, the effort to put into exercise can be very difficult. It's not that easy. We like to say at our gym, it's just a success walking in the door. And everything there, when you walk in the door, is a bonus, because just getting to a gym can be very difficult, especially in this day and age with COVID and things of that nature. But the good thing is we have so many things of access to us on the internet, whether it's a coach, whether it's a class online, we can do them right at our home. And what I also want to talk about is how you get a minimum effective dose in exercise. You don't need as much as you really think. It's more going to be the continual behavior and habit of just doing maybe a little bit something every day and every other day. Another thing that is an obstacle for folks in exercise is going to be, I need a support system. And we know statistically, if you have a support system, whether it's a trainer, whether it's your friend, family member, a group of folks that you meet a couple of days a week, you have such a higher ability to achieve those goals in exercise if you have someone with you. I like to read this quote. It's, friend power, not willpower, is the key to success with your health goals. It's not going to be, we talk about willpower and discipline and things like that. And that has a factor in it, but not as much as having that support system. And the neat thing you guys have here with this MPN conference is this great support system, this advocacy. And so just having a group of folks that are going through the same things you guys are, maybe even creating a group to keep each other accountable, encourage each other to start an exercise program, give each other high fives, be there for each other when someone's down, that is going to go so much farther than this iron will to work out. That just typically doesn't really work out in the end. And the big thing about exercise, whether an MPN patient or not, is you're going to fail. It's going to happen, and that's okay. There's a quote I always say to myself and my team when things don't work out. I say, ever tried, ever failed, no matter, try again, fail better. You're going to, miss days of working out. You're not going to want to work out. You guys go through a lot of different things. A lot of fatigue is as I read about MPN and all the different things that come along with it, fatigue's a big factor. And there's going to be days where you're just going to say, you know what, I can't do it today. It's not going to happen. Or, whatever you're going through at that particular time, just reassure yourself it's okay not to, it's okay to take a day off. And if you are getting into an exercise program and you really want to not miss a day, it's okay to fail. Failure is something that's inevitable in exercise, and that is totally okay. Now, Ann, I'll take the questions. I see some questions popping up, and I love questions, by the way. And so I'm going to take those at the end if that's okay with all of you guys.
That's fine.
All right, perfect. So, what other thing, let's get a little bit into what you should be doing, how it affects you personally as an MPN patient, and talk about high and low intensity exercise and what should you be doing, what really works. What you're going to see on social media and what you're going to see, or see your friends do is the hard, high intensity, heavyweight, I'm dripping with sweat, I can't breathe, that type of workouts. The funny thing is everyone, is those workouts that are super hard and you really push you to limits actually statistically and scientifically don't show to produce better results. In fact, in particular, when I was looking at things that would affect MPN patients is, acute strenuous exercise can increase platelet activation, and we're at 90% max heart rate. There's a lot of contraindications. Many of you folks probably have more depth and breadth of knowledge of all these systems in the body, being that's what you do as far as the researchers are concerned. But when you get above 90% max heart rate, you're not having the heart expand and contract, increasing that stroke volume. When you get a really high heart rate, it actually makes your heart flutter a little bit. Now you can maintain that for just a little bit, but I really discourage my clients that have some type of underlying issue, whether it be a heart issue, diabetes, etc., in your case, MPN, to not get that high. And if you do, let your body come back down, because higher heart rate does not necessarily mean better fitness. Really regular physical activity can, even if it's very basic, walking, a jazzercise class, whatever you like to do, can really help that, prevent the platelet activation. Now, one thing that they have done a lot of good studies for is yoga. And, the beautiful thing about yoga is not necessarily the great movements that they do, the great stretches and all of what they do in yoga. It's that breathing, it's that mindfulness, it's the mental part. And that's where they're seeing a lot of the benefits, in particular with the MPN patients, is just really calming the body down, understanding your breath. The diaphragm is so important to understand how to control. And so what they were finding is research suggests that yoga can improve quality of sleep, fatigue, anxiety, and depression in MPN patients. A few factors that maybe many of you are experiencing dealing with this issue. And if I had to say, all right, Justin, what do you think we should do for exercise? I got one thing I could pick, that's it. I would probably say do some yoga, go to yoga class, do some things at home, definitely learn how to do it properly. But just that breathing, that meditative state, and just moving your body in a flow state can really help reduce some of those things. And so that's what I would say is, maybe start there, because it's gonna be a little bit more gentle. It's not gonna be too strenuous. You're gonna see what your body can handle. But the next thing that you have to think about is, we need to think about our bone structure and our muscle tissue. So you guys are already at a disadvantage, with what you're dealing with. And so it becomes critically important to do some type of resistance training. And when people think of weightlifting and resistance training, they think of, I've got to lift really heavy, or I'm going to hurt myself, or man, it's going to be way too hard and strenuous. Your body can have an adaptation to help reduce or even build, reduce the loss of bone or muscle tissue. And you could also maintain what you have and possibly even increase it, with just a little bit of resistance. They have shown studies where as little as 2 days a week for about 20 to 30 minutes of strength training can delay the onset of muscle loss and bone loss. And it also can, and again, they talked a lot about the blood flow, okay? Making sure that you're basically, when you move more, those systems are going to work a little bit better. And so again, just a little bit of strength training is going to go a long way. And I'd be happy to, maybe get into more detail with that. But the basic things you want to think about is strength training, builds muscle tissue or maintains it, improves blood flow to the limbs, which is critically important. You get much more efficient circulation, and it can also improve blood pressure. So just those 4 huge things right there, what they found through research with MPN patients, should give you a little bit of reason why that you should try to engage in some type of strength training. And again, it's not going to be something that you're, pushing to failure, or you're lifting super heavy weight. And it'll tell you that we kind of go to a limit where we're getting enough of a response, where the body's going to adapt, but it's not going to break you down too much. And that's going to be important, because your recovery level, again, the thing with MPN patients is you're not able to recover as fast. And so you don't want to go real hard then have to take a couple of days off. It's going to be much better to do just a little bit each day and find that consistency, and that'll add up over time, not a real hard workout then say, wow, I'm not going to be able to work out for a couple of days. So we kind of hit on some yoga, we've hit on some strength training. I want to get into some cardiovascular exercise. We talked a little bit about the heart rate and how it may not be as advantageous to do a real hard, like you guys have maybe heard of, HIIT training or metabolic training. I would say that I would stay clear from that and more focus on some just general cardiovascular exercise. And I'll give you guys some tips here. So first off, just 20 to 30 minutes of moderate exercise, which you're getting the heart rate up. When you think about moderate exercise, you're just getting your heart rate up, 20, 30, 40 beats per minute above your resting heart rate. It doesn't have to be too strenuous, because just that alone can improve the circulation. Even in populations with blood and heart issues, just that little bit can make a huge difference. And when we're looking at what type of exercise we should do as far as cardiovascular, what goals we should have. If you want to write this down, there's something called the Maffetone method. It's MAFETONE method. And you can Google that, but I'll give you the simple equation. It's super simple. You take 180 minus your age. So for simple math, if you're 40 years old, it'd be 140 beats a minute. You may want to go a little bit lower than that, all things considered. With what you guys are going through, I'd probably go about 10, 20 more beats a minute lower than that. And it's just basically, think of this way, a brisk walk, or maybe it's on the elliptical. You're going pretty good, but if you have a friend next to you, you can hold a conversation. Maybe every few sentences, you're gonna have to take a deep breath and kind of regather yourself. But it's going to be that simple to improve the stroke volume in the heart, help recovery in the body. Because one thing people we don't realize is light exercise can actually improve your recovery. They actually give you energy, even though you're expending energy and you're expending effort. When you have that big fatigue that some of you will experience with MPN, just a little bit of exercise can revive the body. You get that better blood circulation. Your nervous system starts to fire up a little bit, and you get a little bit more clarity and awareness throughout your day. What we try to do with our clients here of all levels and ages, etc., is that we want you to feel refreshed when you're done. We don't want you to feel like you're just, you have to take an hour nap or something. And so just keeping that in mind. Lastly, is I have a ton of stuff online. I want to invite any one of you to email me at justin@mystateoffitness.com. You can also, I'm not sure if any of you are on a social media outlet. I'm on Instagram quite a bit. You can go to Grinnell Training on Instagram. You can email me, you can message me for any type of individual question that you may have that would be more specific to you and what you're going through. I would be happy to help if you'd like to reach out. I also have some different things on strength training for women and a couple of different PDFs I'd be happy to send to you. And so you can give you more of maybe a blueprint or outline of what you can be doing. But today I just want to share with you that you don't have to make it as hard as you think you need to. It's just about these small things, over the course of time. Think about doing some yoga to give yourself that center, get a little strength training in just to maintain what you have already, improve the blood flow, and just get your heart rate up just a little bit, again, to help all those systems in your body work a little bit better.